Good morning.
Good morning, ma'am.
Good morning, madam.
Can we start? Organizers, please.
Ma'am, just a minute, ma'am. We are setting the aspects. A warm greetings to the gathering. Now we are on the fourth day of this 5-day international workshop. So we'll start the day with Quran. Dr. Yasir will present the Quran today.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم إذا جاء نصر الله والفتح ورأيت الناس يدخلون في دين الله أفواجا فسبح بحمد ربك واستغفر إنه كان توابا صدق الله العليم.
Thank you, Dr. Yasir. So now we'll enter into the technical sessions of the day. The first technical session, titled Integration, Qualitative and Quantitative Methods, presided by Professor Syedul Nisha. Professor Syedul Nisha is a distinguished senior fellow of Indian Council of Social Science Research, a fellow of Royal Statistical Society London, and a member of International Union for Scientific Study of Population. She holds a PhD in Population Studies with over 3 decades of service at Institute of Population Science under the Ministry of Health and Family Welfare. She has excelled as a professor and head of Biostatics and Epidemiology Department. Dr. Nisha has an impressive portfolio of edited books and over 150 published articles in peer-reviewed journals, focusing on nutrition, gender, and health issues. She has presented papers and organized sessions and panel discussions in 21 countries. Under her guidance, now 25 have awarded PhD degrees. As a technical expert, she has contributed to maternal and child health, nutrition, and educational issues for various ministries, including health and family welfare, women and child development, statistics and planning implementation, minority affairs, human resource development, and rural development. Her extensive research includes large-scale population-based cross-sectional impact evaluation and longitudinal studies for marginalized communities, funded by organizations such as UNICEF, WHO, World Bank, and Food Federation, and the Government of India. Dr. Nisha's outstanding contributions to research have earned her numerous awards and recognitions. The PG and Research Department of History feels privileged to host such an eminent person in this technical session. Over to you, madam.
Thank you for nice introduction and for your invitation to speak here. Are you able to see my presentation, all of you?
No, madam, your presentation is not yet visible.
Okay. I will start it again. You have given me this right, no?
Yes, ma'am.
It's visible now, ma'am.
Now it is visible?
Yes, madam, it is visible.
Okay. I'm very glad that you people have organized this international perspective on research methodology. I understand most of the participants are from history background or any other background. What is the configuration of this group?
Ma'am, it is multidisciplinary actually.
It's multidisciplinary. I thought history department has organized, so mostly it must be history students. So we can have different perspectives. I was thinking about history. Basically, in history research, it is very much important that you have to have lot of information as well as unbiased information about the historical events and all those things. But this is true for all the disciplines. It's not only just for the history, but for all other disciplines also. It is very much important that you should have a very good philosophy way before starting the research. So let me show you the first slide. I think this is the fourth day of your workshop, so you must be familiar with many of the things. Research as such, if you look at the research, it is like onion. You have to peel the things one after the others. And the first one, it will be a philosophy. What is your philosophy of doing research? You have got orientation about this thing, philosophy of doing research? Anyone? One participate?
The session started with that kind of activities.
Be louder, please.
When the session started, the first two sessions were regarding the philosophies of research as well.
Okay. So if you are talking about this history or sociology, where we fit, with what type of philosophy we go with that? In your opinion, which one will be better? I think most of you are working professionals or research scholars.
Majority of the proportion or research scholars were.
Okay, so in that case, I will start with this thing. So if you want to do research, you have to have first one is positivism. Means you measure the things, you draw the conclusion based on your measurement. And most of the times, prevalences, rates, and all those things, knowledge is gained by measurement of those things. And the second one is critical realism. So you feel that knowledge is existing and you wanted to critically evaluate that because it is under social cultural destiny. And now I want to concentrate on pragmatism and postmodernism. And why these two are so important, I'm not talking about the middleman. Why these two are so important is that people have said that whatever knowledge is existing, you have to examine it. It's not like this, okay, it's true. You need to see whether the knowledge, whatever knowledge we got, it's unbiased. Just give me one minute, please. I'm coming back. There is some bell in my room. Sorry. So, you need to criticize. The other one is pragmatism. When we talk about pragmatism, it has been said that when you do research, it has to be very comprehensive. You examine it with different distinct from different angles. It's not only the straightforward one way of examining the thing. You can examine it from different ways. And with this philosophy, people have thought what will be the pros to develop theory. Induction and deduction. Maybe you have heard, you are using these words also. But there is one more word, abduction. Had you heard about this thing? Induction, deduction. I wanted to have some interactive class basically. It's not I am examining you or anything, but basically I want interactive class so you can follow the things, whatever I am saying about it.
Participants can interact with the guest, please.
Interact, you can speak in this thing. So basically in this thing, abduction, you are having only few information and few things known to you, and based on that you are drawing conclusion. I can give you an example of this is like medical science. When people come and talk about their symptoms, they the doctor will decide about the disease. He may or may not be knowing exactly what is the problem, but based on the symptoms. So sometimes we do research in this manner based on the available little information and we draw conclusions. So in those things, we need a more explanation about why we are drawing. So the other this thing ring is talking about mono method, quantitative method, and all other things. And at the end of this thing, data analysis and data collection will come. In that, the next circle, I will talk about mono method and all those things in little detail. But the method of data collections, different methods of data collections are there. Survey are there, experiment are there, uh, uh, archival research is there, case study, ethnography, action research, grounded theory, narrative, this thing. And people at the end do cross-sectional and longitudinal study or historical research, content analysis. And at the end, data collection and data analysis will be taught. Okay, so now when we talk about mixed method, I have been asked to talk about mixed method. Mixed method is research with philosophical assumptions as method of inquiry. This has been said. This is a method of inquiry, how we are doing. And it has a philosophical assumptions that guide us to collect data, combination, what type of combination of techniques we should study, and how we should do it, what type of sequence we should follow to do the mixed method. And there are two things, methodology as well as method. In this, first one is the approaches to collect the data and how best we can collect that in a single study, what method we will use to mix this thing. Uh, Use of basically in mixed method, whenever people talk about mixed method, it is the combination of quantitative and qualitative approaches. Okay, quantitative and qualitative approaches. Uh, I understand that you have already covered qualitative and quantitative data collection, this thing. Yes or no? Huh?
Yes, it was handled separately. Qualitative was for a day and quantitative was for a day. It was handled a bit.
Uh, uh, it was not very clear what has been. Quantitative has been explained in detail. Qualitative has not been explained. You want to tell that?
Yes, ma'am.
Okay. So, uh, okay, we will have little bit orientation about what are the qualitative techniques, but in the beginning we will talk about mixed method. Then we will go for qualitative techniques. Also, what are the different methods of data collection of qualitative techniques? Okay. So, now, what are the benefit of this thing? Why we should go for mixed method instead of going only for quantitative method or qualitative? So, as in the beginning, I have said that it is more comprehensive. It's not only that rates, ratios, prevalences we get from quantitative data, but we will also get an understanding about the processes, how these things are happening, why these things are happening, how we can control all those things. So if you want detail about how, why, uh, where it is happening, then we need to have a combination of quantitative and qualitative. And sometimes we can have this thing validity and credibility of our findings also by combining both the things. What data, maybe official data or program data is talking about, and what the people are saying about the programs, policies, different issues. Okay. And history and other things also, what the historical data was there, what is on the ground, that can also be examined by qualitative and quantitative. Uh, interconnected, distinct aspects of phenomena. It can examine similarities, contradiction, new perspectives can be brought it in that. It has a wider distinct scope. When you use in your projects or in your dissertation or other places that you are using mixed methods, so people expect that you are doing very good study. And when you submit a project for funding to any or within India or outside India, international funding, they will give more value when you write mixed method. That there should be also be objective as well as purpose of why we want to do mixed methods. Okay. So it's always better to go for mixed method. Now, it's not necessary. I'm not saying that you always should go for mixed method, but if it is, then it will be a very good combination. So this thing you keep in mind that in your thesis or any other place, you can think about it using mixed method. Okay, so as I have already told you, you can have whenever people do qualitative, those who have used qualitative things, maybe knowing that people will criticize that it's not having, we cannot generalize it because this is a small method and all those things. So, but if you have quantitative data along with that qualitative data, then generalization will not be a big problem. Okay, so you are doing qualitative data in specific areas or specific this thing to give the explanation about quantitative data, then generalization will not be a big problem. So it is said that put meat on the bones. So it's not the structure or the skeleton of the research you are presenting in front of the people, or you are contextualizing it also by giving explanation with the help of qualitative data. So if you have both the things, so what is the rate? How many people are there? Then in that case, you need to reply in the quantitative data, this thing, context. Whereas people say, why this is the behavior? For example, if you have so many toilets are constructed, but in some data said that people are not using. So you need to combine these two things and say explanation why people are not using, what are the problems and what are the things. When on the one side it is looking like many people got the toilet, but other survey is saying they are not using it. So some explanation is required. One statistics is showing something, other one is this thing. And this is also it will be make the data will be make credibility will improve as you are combining both the things and you are saying its validity will be more. Okay, so that way if you you mix method this thing in your research proposal or in your project proposal, it has more value, and you can think that you want to generalize this thing, you want to triangulate both the things and come out with the valid reasoning for that research. So in that way, it will have more value to it. So just in the beginning, I said it, I will explain to you in detail. Okay. Mono method means you are using only one methodology of data collection, that is quantitative or qualitative. So many people do only with qualitative thing and quantitative studies. Any example of quantitative studies or quantitative thing you people have done or you have seen? Just can you talk about it? Anyone? Anyone from the group or online participants? No? Okay, no problem. No problem. But whenever the things are known, very much known, for example, calculation of GDP or maybe fertility rate, mortality rate as a population scientist, or migration flow from inflow, outflow, or out migration, in migration, all those things. you will get idea from quantitative studies. Okay, NSSO is giving this thing, and percentage of poor and all other things are we get from quantitative study. Okay, on the other hand, qualitative studies are done to examine small this thing like jailers behavior, jail inmates behavior, or small case studies about cancer survivors, or maybe the museum collections, or all other things. Qualitative, small level studies are there. Mostly qualitative studies are in anthropology, people use qualitative, in sociology also people use qualitative thing, and history and other places also people use qualitative thing. The one we have talked till now about the mono method. Other method is multiple methods. What we call it is multiple methods. In multiple methods, multi-method and mixed methods. There is a difference about multi-method and mixed method. What is the difference between these two? In multi-method, qualitative studies can be there, and multi-method, quantitative studies are there. So what do you mean by this multi-method, quantitative study, qualitative study? Basically, we are using 2, 3 quantitative techniques to have multi-method of this thing. For example, I have used census data. Also, I have used this official statistics. Then it will be a multi-method. Means my data is from 2 different sources. That these 2 sources have a different method of data collection. So, uh, these two are who agencies are different, people are different. Similarly, in multi-method qualitative this thing, so maybe people have used key informants interviews, in-depth interviews, case studies, different type of techniques they have used, qualitative technique, all qualitative technique. Then also it is known as multi-method research. When it comes to mixed method, this thing, mixed model research are used, quantitative, and this methods, different methods are mixed model research as well as mixed method research. This is known as very simple to complex. Sometimes different strategies are used to collect the mixed method data collection. Okay, so now next one is, are you following? Should I continue? Or if you have any question, anything, stop me. Okay.
Yes, ma'am.
So till now it is clear what we are discussing. We have discussed about philosophy. We have discussed about induction, direction, abduction.
Yes, ma'am.
Then we have discussed about the different type of this thing, methodologies of data collection. In that mixed method is we are today going to talk about mixed methods. Okay. In
Yes,
mixed
ma'am.
method, in mixed method, people have also said that there are can be different things of this thing, doing the work. So sequences here, many researchers, mixed method researchers, they have given a different names. Some of them have used qualitative, quantitative, quantitative, qualitative, different this thing. Okay, so here convergent parallel design, parallel mixed design, qualitative and quantitative. You can see this thing. Uh, one is written in capital letter, one is written in small letter. Why it is so? Basically, in these models, qualitative is dominated by quantitative is not. In other places, quantitative is dominated, qualitative is supplement to it. And some places both have equal this thing. Both have equal say in the research. Hmm? Qualitative as well as quantitative in both the embedded design, transformative design, both have equal share. But some can be, one methodology is dominated, other is just supporting, or to support one of the things, second one is done. Okay. So I will give example about this thing. So here, one is triangulation design. Maybe not very clear to you. Is it visible to you?
Yes, ma'am.
Class people those who are in PG research hall, how many are there in the hall? I have seen only chairs there. People are there?
Yes, ma'am. We have a research scholar of our department and regional colleges. People have been.
Mm-hmm. Okay. Okay. So thank you. Thank you for updating me. And only 1 hour time is there, so I'm going little fast, but you can stop me in between. So
But
there is no.
sorry to interrupt you. You can take your own time, madam, because we have one session today, so you can take your own time.
Okay, so there is no problem. That I should complete it by 11 sharp 11.
Yes, ma'am. Yes, ma'am. You can take your own time, ma'am. No issues.
Okay. Okay. So what I feel qualitative in triangulation designs, in triangulation models, what we do is qualitative and quantitative research are done independently. Both the peoples, both the things, groups are different. Sometimes different organization expertise, different expertise are there. So the research project is done by one person who is good in quantitative data collection, and the other one is qualitative data. These two are combined when we are presenting the result. So this has been done independently. Huh? Uh, so they at the end only they will come together and draw the interpretation based on this thing. The second one is convergence model. In convergence model, it can be quantitative, qualitative, many things are there. Data is collected, analyzed, results are seen. Qualitative also data collection, collected, analysis, and results are seen. Then before drawing conclusion of this thing, a comparison is made. What are the contrasts we are getting it from qualitative data, and what are the contrasts we are getting from the quantitative data, and at the end conclusion are drawn. So in both the things, in this thing also qualitative and quantitative are getting equal this thing here. And other one is similar type of things are there. We will talk this thing. Quantitative data collection is there, but here interpretation of two quantitative sets are done, and interpretation of qualitative and quantitative are done at the end. Validating quantitative data model. So other one is triangulation design, but here we are validating the quantitative design. Just now I have given you the example about the toilets and all those things. Here we are validating this. And multi-level testing models, in multi-level models, what we do at different level, we will collect data collection in a different manner. For example, long back when I have done infertility survey, what has been found, we were not knowing that what language people use in the localities about infertile women and infertile men, and how they are describing about the problems, issues, and all those things. So for that, what I have done, I have started with qualitative this thing about learning the language, learning about the problems. So key informants interviews were conducted and all. Based on that, based on that, quantitative data was collected. First, mapping listing was done and identified the childless couple in the community. It was not like that anybody we can name it as infertile couple or childless couple. So we need to have something inclusion criteria, how many years of marriage we want to fix, how many this thing we want to view, what will be the age of the woman, whom we can say that she is facing the problem of infertility. So for that identification, we have gone at length and done a complete census of the households, whichever village we have selected. And after that, interview was done. Interview of women was done. as well as health camp was also organized to see the causes. What has been found in from this quantitative data collection is that around 11% couples have this thing, second wife, woman is having, and husband is having another wife. And there were people who have not yet gone for any this thing, medical services. And the other one was about they have gone only religious methods about this thing, and the other one is a lot of allopathic cases. So we thought these are quite different cases. We need to know about why such a different behavior is there of people, and why so much second marriages are there in that. So we have done case studies of these couples. That was the third stage of this thing. And also we have done the fourth one, how many are still in that villages with the child, with that husband, or how many got divorced. So different level, different examination, different things have been examined. And it was quite surprising. I want to share one of the findings. It was 11%. So we have done this qualitative survey of this woman. And what we have found is that some of the women are arranging second marriage of the husband. This was quite different thing, unexpected thing, unexplored thing. And we were so much surprised. So when we have asked about the reasons and all those things. So in case of India, women is, after marriage, there is no place for women to go back to her mother's place. So she was saying that anyhow husband will marry because I do not have till now the child. And when he will marry to an unknown woman, I may not have any place in this house. I want my own place in this house because I do not have any other thing to go. So I thought I will bring a woman who is familiar to me and she will treat me like. In case she will have children, uh, they will play with me and I can also treat them as my children. But some of them already know that their husband have problem, then also their husband had gone for second marriage, knowing that they have a problem. And some of the women were not knowing what problem they have, but they have arranged the marriage. The husband said. So it may not be her fault, may not be a problem for her. This thing. So in one of the case, it has been found quite interesting. The first husband had first wife, and she left or he has left her. The second marriage was also there. The third marriage was also there. In the third marriage, she succeeded. What type of treatment she has taken? She said, I am taking only traditional man. I used to go to religious places to have. I do not know what was the thing. But these are the things which we never expect, never know about the culture, society, how people react to different situation. We will come to know by using qualitative techniques. Okay, qualitative techniques. So we can have little more explanation about convergent parallel design, and in convergent parallel design we can have, as I told you, quantitative data is collected separately, qualitative data is collected separately. At the end we draw the conclusion, and here there is an example about accidents prone area, use of cycling, whether and what are the spots they have identified, whether they can blame this thing. Sometimes it has been said that these are accident prone zones. How this is done accident prone zone? It's not the who are the persons who have done the accidents there. You need to identify, and all those things you have to explain to the. In that case, we can have convergent parallel design. One in this embedded design, number is we can have one after the other also together, one after the. So we can go for embedded design. and explanatory, we want to explain the things, as I told you just now about explaining the things, why this is happening. So you can do sequential this thing, and at the end you explain the reasons for those things and explore. If you look at my study, which I have talked to you, in the beginning, it was exploration for what type of language people are using, what type of things they are doing. So we can study with qualitative first. First qualitative, then explore and go for quantitative. So you got the difference about these things? Yes or no?
Yes, ma'am. Yes, ma'am.
Class people, I think there so many people are sitting. Do it together. Explanatory, this thing, you explain it afterwards. Explore it in the beginning with qualitative, end with the qualitative, or have sequence one after the other, or have sequence one after the other, and use the interpretation at the end. ठीक? Yes, no, please.
Yes, madam. Actually, we have an echo issue here in the hall, so just one mic it is properly working, so we couldn't make it.
Yes, so all of them might not be having the
We'll,
mic to speak.
we'll rectify
Mic to
it.
speak.
Okay.
I, uh, in my mind, I thought it is a history's research, but as you said, all the people are there. So, in historical this thing, primary source of data will be physical objects, letters, diaries, photographs, official record, and article. If you are doing uh, research on health. So what are the things you need to consider? We have Ministry of Health website. We have different surveys, National Family Health Survey. So you can use that data as a second this thing. And primary data means you can go and collect yourself. This was in context of historical this thing I have given. But if you are talking about primary data, quantitative primary data means you need to have questionnaires and all those things. You frame your questionnaires according to your objectives, and you go to the field and collect the data according to your objectives. Okay. In that, if you are going for primary data collection, what are the other things you need to keep in mind? What will be my sample size? How I will select the community or society, whether I want to do it for some specific area, or maybe I want to make it as a very representative. So in that situation, sampling will play important role, as well as identification of area where you want to do a study. Okay. So what we can, any this online people who PhD students, any PhD student is there in online group? Because online people can speak, whereas classroom people, there is a difficulty, I understand. Anybody is there among online people, research scholars? No? Okay, so no problem. So if you are collecting your own data, that is known as primary data. Okay, primary data. But here in historical this thing, this is something different, primary source and secondary source we are. If you are using census data, or if you are using this survey data, as I have mentioned, National Family Health Survey, or NSSO data, or official statistics available on the website, that will be your secondary source for quantitative. Now I'm talking about quantitative data. And if you want this thing, quantitative data, you can also do quantitative data by going to hospitals and collecting about inpatients, how many are there, what are the disease or frequencies of this thing, uh, about inpatient this thing. But from this, you will not be able to calculate the rate, how many people are suffering from this. How many, that is, if you are talking about uh, hospital data, it will be only numerator population. We call it as a numerator population. If you, how many deliveries, cesarean deliveries, in those deliveries, how many have faced the cesarean section, non-cesarean section, something like that you can talk. But what is the prevalence of cesarean section in the community, you will not be able to tell. Similarly, in other things, those who are working, huh? What are the facilities they are getting? Non-working persons, if you go to offices and collect from the offices, women, how many women are there? How many, and what are the problems they are facing to manage home and office and all other things? You will get an idea from their interviewing them, but you will not even get an idea about the women who are not working. So here generalization will not be there. You will get an idea about the people who are. So you need to understand basically primary data collection and secondary data collection. In case of history, oral histories are also seen as a data source. Sometimes we take speeches of the people, huh? And the audio records and photographs and all those things are taken as an history documents. And apart from it, in history as well as in other economics, sociology, and all other this thing, geography, and all other places also, people has used when they want to do research. They have used census data, demographic history, economic history, social history data, all other things have been used. And if you want to have a comparative this thing, comparison of two type of states, two countries, two other places, two different groups, hmm, that comparison can also be done. And interdisciplinary approaches also. In history, interdisciplinary approaches are there, as well as in social science also, in medical science also. Nowadays, people are having interdisciplinary approach. Maybe sociology person, demographers, and they come, medical doctors, they come together to carry out the research. Okay. So, uh, this is the combination of the people coming together to carry out this thing. So, not only this, what we have started talking about multi-method, this thing, uh, multidiscipline research is also very much appreciated. Multidisciplinary approach to any issue is also very much appreciated. For example, if you want to do nutrition study, nutrition of children, nutrition of women, who should come together here? What discipline people should come together? Nutritionist. Nutritionists, demographers, medical doctors, okay, agriculture scientists, planning person, rural development person. So all of them should have come together to solve undernutrition problem. It's not just giving a rates and ratio will solve the problem. So all this group of people, if they come together, then only the problem of undernutrition can be solved. The other one is about in history. This is keeping in mind. I have used digital histories, but we can also use geographical information system where in geography people use it, as well as in disease prevalence also people use geographical information where this is much more prevalent in comparison to other areas. This gives a good idea about uh, the other problems. What are the food problems are there, or infections are there, or maybe what type of water facilities they have, and those have the diseases. So those things can be identified by using geographical information system. And I am not giving much importance now to history, this thing, but people in history, they have used handwriting, this thing study. They have, when they wanted to do research in history, they have studied the handwriting of this thing. But in other disciplines, you do not require so much this. And documents, records, and establishing date of this thing, financial inscription in the case of history, but you don't have to. In the case of history only, I am giving industrial revolution. This has been based on the lot of data from factory records, worker directory, economic report, demographic data. These have been used. Suffrage movement, role of women has been examined in history. This has been examined, and they have seen the speeches, they have seen the movements, different writings, what are the writings have been come across. And this slavery also, it has been said. World War II was also examined using mixed method, So all these four example in the history have used mixed methods. So as it has been said that you people are uh, from different disciplines. So what I will do, I will share the different techniques of data collections uh, for qualitative thing. Okay. In mixed method, I said you are going to use quantitative thing as well as qualitative thing. In quantitative, you go for data collection on your own by having questionnaires, and you will go and collect the data. Whereas in qualitative also you will collect data, but it is little different techniques. You will use different techniques. Okay. So, no, we will not, yeah. Qualitative data tools. So here it can be unstructured interview, semi-structured interview, is structured or is interview techniques, group interview techniques, focus group discussion, non-focus group discussion, mapping and this thing modeling, timeline, observations. So these are the techniques, data collection techniques for qualitative. Unstructured interviews. Anybody can talk about unstructured interview? Maybe many times we do unstructured interview. We do not have any questionnaire or schedule in our hand. Sometimes we just start talking to the people. It is known as unstructured. You get the information about what is going on. Okay. On the railway platforms, we talk to people, or maybe when we are waiting for some other thing, or maybe then the hospital, we talk about this thing, unstructured this thing. So those are unstructured. And sometimes semi-structured, but some questions are there, but you want to expand it and you want to ask more this thing, detail. This will become semi-structure. Structure as systematic interview technique. You have a structure, you wanted to collect the data according to that questions, according to the domains you wish to collect the data. And focus group discussion means on some of the issues, you are collecting information from group, not on from individual. Okay, not from individual, you are collecting from group. Then that is uh, known as focus group. A non-focus group discussion, here you are talking in general about this thing. Mapping and modeling means here also there are something like this. You are identifying the places, information about that. And this will also help them to open up, talk to this thing. Okay. And timelines also, timelines are important in general as well as in history and other places. What happened at that time and what is on the time, you can draw the conclusions, how this has been happened, how what has happened, positive, negative, all those things. And observation, participant and structure observation can also be there. What is the people unstructured interviews are there? If you go to any rural area, you start talking to the people of authority in that village. This will help them to open up. You are talking something like what is the weather, what type of farming you do, or what type of testing. Some simple questions. It will open up. They will feel, yeah, these people are quite friendly. Otherwise, in the mind of the people, it is like this. So people from outside come and collect the data. How it will be useful for us? Why we should give information to these people? So this type of apprehensions will be there in the mind of the participant. So to overcome this, what we can do, and structure is in the beginning, whenever we are entering into the community, don't go with a big questionnaires. So for first 2 or 3 meetings should have been something like unstructured interviews or interacting with the people in that community. Okay. So this will help you to collect better quality data. Uh, uh, because from this unstructured interview, whatever you have collected, or maybe you want to use it as a research purpose, it will be difficult to analyze as well as draw a conclusion based on this thing. Uh, Interview guide. Basically, in a semi-structured interview, we do not have uh, full questions or all those things, but different headings will be there. Under each headings, we will capture the information from the people. And if it is required, we can add more question on that theme or on that domain or all other things. So, uh, covered under the exact order and wording of the questions may vary from a respondent to a respondent. Maybe sometime you are asking about the childbirth and all other things. So she has started using something different, then that sequence have to be changed. Or maybe you wanted to see during childbirth and all those things, what food items she have used, but she in the beginning itself she has talked about the food. You need to ask other issues, other questions afterwards. So here the fixed sequence is not there, as well as flexibility of asking the questions will be there. In semi-structured this thing, we use interview guide. Interview guide means only domains and big subjects will be there. Under that, we want to collect women. Just I am giving you because I am mostly I have done work on women, children, and all this. Women work. So you wanted to collect information about whether woman is working, participating, what level she is participating in economic activities. The other one is how much time she is spending in household this thing, and how much time she is spending on child care and family care and all other things. So you have a questionnaire about women's work, and so under that you are collecting the information, and it can be in any sequence you can collect this thing. So that is known as uh, so it has a you if you have good understanding about the subject and what you are collecting, then only you can will be able to develop interview guide. Okay. In-depth or depth interview is more exploratory. Interview intensively investigate a particular topic, the purpose of depth and focus group. For example, if you want to have something like water pump in the village. So if you ask in one individual, say, the person will say, we want that side, we want this side, we want that side. Instead of that, make the group person sit together and check with them where they want. But for this, you need to have very this thing. If only dominating caste or dominating group will be there, this thing argument will be there. But you can collect the information about how it will facilitate other people, or those who do not have in their home own well or own bore well, how it will benefit them. So keeping in mind, you need to make it as a focus this thing and collect information. Or maybe you wanted to have some information about the education of the children. So you can ask parents as one group, talk about the facilities and available facilities and all other thing in that areas from the parent point of view as well as from children's point of view. What are the things they required? What are the things they are expecting from government or officials? So it can be a very focused this thing. And in that you need to also keep in mind whom you want to collect and what you want to collect. Okay. And case studies, comprehensive, these are all, I'm talking about qualitative this thing. Uh, in-depth information about particular cases of interest. A case can be a person, an event, illness, episode, a program, an organization, a time period, or community. Case studies does not mean it's a case only. It can be organization, it can be an event, it can be this thing. Okay. So for maybe somebody have announced some policy, some program. You want to see how many are using it, how many have the knowledge about it, and all other things can also be collected. This thing. And detailed information about that only, that specific this thing, whether it is a policy, whether it is event, whether it is illness, that information you will collect, and then it is known as case study. Life histories in history is also there, other places also there. People use ethnographic description about lives of different individuals. Okay, so this is also used as a source of data collection. There is another thing, cultural domains, cultural rules that people carry around in there. That is the people think and know about. Sometimes what happens when we, as a researcher, it has been said that quantitative data is unbiased, but not necessarily it is unbiased. Basically, as a researcher, you frame your questions and go and ask them. Just one simple thing I want to ask all of you. What do you mean by RTI? RTI.
Information Act.
Huh?
Right to Information Act.
Okay. Ri- Right to information. Okay. But if I go to some other place and I ask medical doctors, gynecologists, she will tell me reproductive tract infection. Okay, if I go to other chest specialist doctors, they will say respiratory tract infection. The same, this thing is there, but where I am using and the definition will change from place to place. So you need to learn from them what they are using it. For example, we use a word delivery. Delivery in different languages have different this thing. Somewhere it is said Zajgi, Japa, huh? Different words. So each culture have different language, different illnesses. In other places, it has been found. For example, people have gone with the importance of diseases, something like this. Cancer, HIV was very common and all other things. And they wanted to know about the knowledge and all those things. And they have also said which disease is very dangerous for this thing. In the rural area, the people are having different disease problems, and death was also, cancer was not there, maybe not known to them, that it is not detected, maybe people are dying, but they are not. HIV was also not very known to them as well as not aware about it. But what they have written, what the serious disease is diarrhea. Why it is so? Because people in that area were not getting good water and there was many deaths due to diarrhea. So basically we need to see the local problem, local issues when we are framing the questionnaire. Don't go by your own thought that this is the serious problem, this is the thing. So you need to think about what they think So to understand that cultural domain, it will be good to start with the qualitative data collection in the beginning and collect the cultural domain. So one of the things which I have also used, and I also suggest you, so whichever area you are selecting for your study, first visit that area and collect the language on each one of these things. For example, what are the diseases prevalent here? What are the educational problems prevalent here? So you will get a list of these things. What are the financial problem? Any things, whichever according to your topic. Collect the list of the things, then use it. Similarly, people have collected free list from the patients to draw the conclusion about the disease. So they will say cold भी हुआ था, cough भी हुआ था, running nose है क्या, then they will draw the conclusion. So this is doctor is saying, but instead of that, if doctor will ask the patient since last 1 week or since yesterday, what are the problems you are facing? So if the patient will give all these things, then that is own this thing. But if you pose a question, ye hua tha, what happened to you, whether you have faced this, and the conclusion, that is a quite different thing. You are hinting them, so somebody will say, yes, what? Maybe it had happened. Maybe I was not able to sleep in the night. But ask them to describe their own situation. So you collect the list from them about the symptom and give the disease this thing. So that will be better than just giving this thing. Similarly, other techniques are also there, pulse sorting, group interviewing, and all other things. So this was orientation about qualitative techniques. You can use different key informant interviews are also there. Key informant interviews means those who are having knowledge about their subjects, they are interviewed. Then it is known as key informant interviews. So these are few qualitative techniques which you can use: case studies, key informant interviews, focused group discussion. For focus group discussion, don't use very sensitive question in the group. Basically, this will people will not open up. Maybe sexual behavior you wanted to ask, or maybe political behavior you want to ask in the group. That will not be very good, because maybe people are having different political this thing ideology, and making them sit together and talking about means can create violence also. So you have to have a general topic which people can respond to your questions. In qualitative technique, in-depth interviews are key informant. In-depth interviews means for some persons who are suffering from some disease or some other thing, you ask about, maybe somebody is getting government benefit, you wanted to ask what is the process of getting it, how they have learned about this program. So this will be in-depth, this thing, individual will be useful. And if officials you are interviewing about the policy or some this thing, that will be known as key informant. This thing, you are talking to them as a key informant and asking them to describe how they have implemented. Or maybe health providers, ASHA workers, Anganwadi workers, ANMs, and all those people, you talk to them as a key informant interviews to know about the health of the children, women, and all. Okay, so let me stop it here. There are so many things which we can continue, but let me stop it here. And if you feel like asking some questions, feel free. Feel free to ask me. Still you are seeing presentation, or is stopped?
Presentation is visible, ma'am.
Okay. So if you have anything which you wanted to ask in classroom, you can come, one of them can come and ask this thing. I feel young scholars are sitting there. All young scholars are sitting there. I am very happy to see all of them have interest in doing research. All the best for your research, this thing.
Thank you, ma'am. Thank you, ma'am. Thank you, ma'am.
Welcome, welcome, welcome. Although personally I have not interacted, but looking at you people, I feel happy that you have interest in research. Carry out, do good job, and take a topic which is very useful for the society, community. Don't do it repetitive work. I don't like a repetitive work of somebody has done for Dindigal. Let me do it for Madurai. That is not this thing. See, examine, read, and talk to the people, and then learn about what will be the useful for me. As well as a researcher, young research scholars, you also think about job perspectives also. If if I do this type of research, how it will be useful for me to get this thing. So that way you think about your topic, decide about the topic, and do some useful research work for the society. Okay. So maybe educational issues, maybe women's issues, maybe health issues, maybe historical issues. So many things are there which is not explored too much. So already explored things, don't repeat those things. Do a good new research and discuss with your guides, discuss with your teachers, seniors, and do a good job. Thank you very much. Thank you for giving me opportunity to interact with you people. I think at this point I'll like to end. Any other formality or anything is there where you want to go? Or I can close this thing. PG department. Should I leave?
Do participants have any feedback or questions to ask with madam? Participants can open up if you have any doubts regarding the sessions.
Okay. Okay. Thank you very much. Thank you very much, everybody. Thank you very much.
Thank you, ma'am. Thank you for a wonderful insights shared. Thank you, ma'am.
Welcome. Welcome.
ربي جل الله ما في قلبي غير الله نور محمد صلى الله لا إله إلا الله الأول والآخر هو الظاهر والباطن هو جل جلاله سبحانه لا إله إلا هو حسبي ربي جل الله ما في قلبي خير الله نور محمد صلى الله لا إله إلا الله അഴകിലും അഴകായി വായുന്ന അഹദവനിൽ പ്രിയരാകുന്ന അതിശയനൂറ് പൊഴിക്കുന്ന അമ്പിയ രാജ റസൂലുള്ള ഹസ്ബി റബ്ബി ജല്ലല്ലാ ما في قلبي غير الله نور محمد صلى الله لا إله إلا الله آدي زماني دنيت نبي عالمي نيت نبي آخر لوكم الذي بديت الله من حبيب نبي حسبي ربي جل الله ما في قلبي غير الله نور محمد صلى الله لا إله إلا الله. Thank you for this wonderful praises from the name of Lord. So with this, we'd like to end today's technical session. So with this, we'd like to end today's technical session. So we reconvene for the next technical sessions tomorrow. Tomorrow will be the last day of this 5-day international workshop. Tomorrow we have 2 technical sessions being scheduled. So we'll reconvene as scheduled. Thank you. We thank all the participants who joined with us today for your continuous support. So we reconvene for the sessions as scheduled tomorrow. Thank you.